Hey, this is Doug Field along with my co-host Ron Bachman, and welcome back to Healthcare Consumerism Radio. As I stated on the first segment, this is going to be the first of a two-part radio program series on celebrating the upcoming anniversary of health savings accounts. And, what a great way to kick off the program than to have Mr. HSA himself on the program.
Really?
Joining us is Roy Ramthun,
great guy,
who's founder of HSA Consulting Services. He was involved at the very beginning of HSAs in the Treasury Department, then went on to be health policy advisor for President Bush, and he's also a member of League of Leaders. We're very proud to have him speak at every forum event. Roy, welcome to the program.
Good morning, guys.
Hey, good to have you here, my friend. We got 13 minutes for you to talk about the history and the present and the future of HSA. And I know that's one of your passions, and you've been very instrumental to where it is today. Kind of give us a quick run through of where we've come, where we are, and where you see us going.
Well, I have to say, it was such an honor for me to be able to serve our country in this capacity because I recognized what HSAs meant to healthcare financing as soon as I heard about them. I'd been familiar with the demonstration project prior to that. But, for all the years of work that I had done on the government and in the private sector, to me the HSA really puts the crux of how healthcare is financed back at the centerpiece of the conversation. Most of us have made so many assumptions about how much healthcare costs and how much we consume as a result, because we really don't have a stake in how much to pay for all of those things. We've made a lot of assumptions about what's covered by our insurance, and as a result, we end up, consuming healthcare like it was free. Mm-hmm. So I was very excited to have the opportunity to really launch this program and watch it grow over the years to something that I think is really contributing to the recent decline in annual rates of increase in spending in healthcare, which for a small program, which is a small piece of the total puzzle here, I think is quite remarkable.
Yeah. It really is, Roy. It's Ron Bachman. How you doing today?
Great.
The HSAs, when they were passed, give a little. We're talking about celebrating this, but let's give us a little bit of background when it was passed, how it got passed, what it was a part of, and you were at the Treasury at the time running the regulations, as I recall. Tell us a little bit about that time period and what was going on.
Well, most of the effort was focused on getting the Medicare prescription drug legislation passed. This was an issue that Senator Ted Kennedy and President Bush were very involved with and wanted to kind of make part of their legacy. HSAs were a key piece of actually getting the votes to make it pass, but most people weren't focused on the HSA provisions at the time. They were focused on the Medicare pieces, and it was sort of a historic crossroads, if you will, because there were a group of Republican members in the House of Representatives who were very concerned about adding a new entitlement program onto our federal budget. We hadn't had much success in controlling the cost of Medicare up to that point. What would make us think that we were going to do any better by adding a new benefit, especially an expensive one like prescription drugs. So it was really their insistence that HSAs be included in the legislation in order for them to vote for it. And it was that really sort of political opportunity, that compromise that got us to where we are.
As I recall, and what you're saying, I think, to be clear for our audience out there, it was that the HSA enabling legislation was tacked on to the Medicare Modernization Act. So it's the way you get things done in Washington, right? You attach something to another bill.
It's part of that sausage-making process.
There you go. Now, another piece, again, the background on some of this so that people understand, we almost didn't get the HSA legislation and the Medicare modernization because normally at that time, as I recall again, that the process has been set up for 18 minutes for a vote, and they didn't have the votes at the end of 18 minutes. And they extended that vote, got all those Republicans who were concerned about all this, told them about, well, the real value is in the HSA piece that's being attached to it. And when they went back, maybe you recall more, I think they only passed by about 4 votes, didn't they?
It was very close. It was sort of the part of the arm-twisting process, if you will, in order to get this legislation passed. Even the president's support for the legislation was not enough for some of the Republican House members. So we've seen this happen before with other legislation. It happened with the Affordable Care Act in the House of Representatives, too, which squeaked by through a very tight margin. It is part of the political process. We have to recognize that sometimes that's how those things happen, and sometimes they don't happen because the window of opportunity closes before they can secure the votes.
Now, you were at Treasury when that happened, and you actually had served, as I recall, over in the Congress, helping, was it in the Senate side or the House side?
Senate Finance Committee,
Finance Committee. Tell us about how that works when the bill is passed and it goes over to the Treasury. You've got this HSA legislation, which no legislation is entirely clear and straightforward. What did you do with it when you got it over to the regulatory side, over Treasury?
Well, the first thing we did was try to quickly put out a little bit more clarification and sort of summary of the major provisions, and we did that before the end of the year. So in less than a month, we got out some initial guidance to just help people understand the key pieces. Anytime you read legislation, you're not sure if you actually understand it. So we tried to organize it in a way that could be logical so that more lay people could understand what the HSA opportunity was. Then we called a big meeting of interested stakeholders, employers, banks, insurance companies, et cetera, and we met at the Treasury Department in mid-January and asked them to tell us what were the key decisions that we needed to make that would be most helpful to them in understanding how this legislation was supposed to work and how they could go out and create products. You know, what were the uncertainties that they had after we had done that description? And that shaped our guidance that came out in March. I think we put about 3 or 4 more things out in March, and then a larger package in July, so that by Labor Day we had put out 8 pieces of guidance in 8 months' time. That is almost unheard of in the federal government.
A lot better than what's been going on with the regulations for 3.5 years under Obamacare and 10,000 pages. What I recall in that period of time, Roy, was that one of the real values of health savings accounts was 100% coverage for preventive care, because everybody's always worried about preventive care, so that you didn't avoid preventive care services. But as I recall, there was a problem with the legislation on preventive care, and you had a pretty good load to identify what was allowed under preventive care 100% and what wasn't. Did you recall that piece, and can you tell us a little bit about it?
I recall it very well.
I figured you would.
The statute actually has a sort of mysterious reference
to a wrong area, or nowhere,
which made it very challenging to understand, well, what did they really intend to use as a definition for preventive care? The reference in the law doesn't go to a place in the Medicare law that's helpful in understanding what they meant. So the IRS then started looking for definitions of preventive care that might already be available that would be helpful to crafting a definition, and found the U.S. Preventive Services Task Force, which is an arm of the Department of Health and Human Services, which analyzes all of the research on various medical services and then gives each preventive service a ranking. And it's based on evidence, clinical evidence of how much do we actually know about whether this does in fact prevent anything? And I think they felt the IRS felt most comfortable with sort of a classic definition of preventive care. We're going to limit that to things before you're diagnosed with an illness or a condition or a disease, and what types of services prevent the onset of that disease. Now, there are a lot of
So you really helped.
people.
Let me sort of jump in a little bit. You really helped to define the preventive care services that become so important in the whole wellness movement of healthcare consumerism, is what you're really giving some of the background on. So really you started the whole process of being able to more clearly define even what's carried over into Obamacare now in the way they've gone to the same U.S. Preventive Services Task Force, right?
Exactly. That was the foundation for how they defined it in the Affordable Care Act.
So let me move a little bit to, you then moved from the Treasury over to the White House to become Bush's chief health care policy advisor. HSAs were so valuable. We haven't got that much time left, but a few minutes. But can you tell us how you began to form a national health reform program around health savings accounts? Because people say, well, there were no Republican ideas for national health reform. But, in fact, you had one. The President Bush was using HSAs as the foundation for a potential national health reform, right?
He absolutely was, and in his budget proposals while I was there, we developed a number of proposals that would have expanded HSAs and tied that to the availability of financial assistance through tax credits to individuals who are buying insurance on their own and get no favorable tax treatment for the premiums that they pay. We know that that's a huge gap. Self-employed individuals don't get the same tax advantages that employees typically working for employers get, and so we tried to make HSAs the centerpiece of the expansion of health coverage in ways that were market-driven and market-based, but would give consumers the ability to take advantage of these opportunities, and then even make the HSA account even more attractive, where they could cover all of their out-of-pocket costs, not just their deductible, which had been sort of the model up to that point.
So with that whole concept, we and the success we're seeing with HSAs to control healthcare costs, we actually, if we had been able to move forward with that, we could have had what I might have called an HSA nation, right?
Mm-hmm. Yes.
And that would have dramatically changed everything.
And we argued very strongly to legislators that, we know that health reform is a concern of many people. They don't have access to affordable health insurance. Right. This is a way that we can provide that to them and get ahead of the curve before those who advocate for a government-run solution to the problem gets legs. Well, we saw what's happened as a result. Right. We didn't address the problem, and now we have the Affordable Care Act.
Right. Well, thanks for your input here, because I think we may actually get back to that at some point. Any last way for the people want to find out more about what you're doing and your continued involvement with HSAs? Any final words in these last 20 seconds?
Well, I've devoted my life to, since that point, to promoting HSAs and consumerism in healthcare, and the company that I founded is devoted to that. And so if you go to our website, hsaconsultingservices.com, you can find out more ways that we can help you. You can also go to my educational website, HSAED.com, where you can get answers to frequently asked questions.
All right. Well, thank you, Roy. I hate to cut you off.
Information we want everyone to have.
We got a hard stop. So thank you very much for your input. We'll have you back and even get into more of this, and look forward to seeing you in Las Vegas for the big celebration party.
Thanks for including me on the show.
Thanks, Roy.